If you have pain shooting down one leg all the way up into your ankle, you're probably wondering what exactly is causing it and why it's traveling so far down your leg. The good news is that this leg pain pattern often has a very specific cause, and in this video I'm going to explain it in a simple, easy to understand way so you can better understand what's happening and what to do about it. Then I'll walk you through 5 targeted exercises specifically designed to quickly relieve one-sided shooting leg pain that travels all the way to the ankle. Some of you may notice relief within just a few minutes. Now make sure you watch until the end because all 5 exercises are designed to help relieve this type of pain. Some people respond much better to certain movements than others. 1 or 2 of these exercises may provide the relief that you've been looking for, but you won't know which ones those are unless you watch through all the way and try them all. So do watch to the end because missing any part of this video could mean overlooking the very exercise that may calm your shooting leg pain and keep this problem from becoming a chronic issue. My name is Dr. Philip Cordova. I am a chiropractor here in Houston, Texas, and for the last 29 years, I have worked with patients dealing with chronic lower back pain, sciatica pain, lumbar spinal stenosis, and disc herniation that did not fully respond to traditional treatment approaches. Before I show you these 5 exercises to help relieve one-sided leg pain that travels all the way to the ankle, let me explain what may be causing it in the first place. First, I need to mention that this video is not meant to diagnose your condition or replace the advice of your healthcare provider. If you are dealing with pain shooting down one leg, you should always be evaluated by your medical doctor, physical therapist, chiropractor, or another qualified healthcare professional for a proper diagnosis and a treatment plan that is specific to your condition. So why does this happen? One of the most common findings I see when assessing patients with pain that shoots down the leg and into the ankle is a lateral disc protrusion or a lateral disc herniation. One of the biggest frustrations I hear from patients is that they spend months treating the painful part of the leg without realizing that the source of the problem may actually be in the lower back. When one of your discs in your lower spine becomes injured, the outer fibers of the disc can develop small tears, allowing the inner disc material called the nucleus pulposus to push outward. When that bulge moves backward and off to one side, it can begin pressing into the space where a spinal nerve exits the spine. That opening is called the neural foramen. Now, if you have ever read your MRI report, you may have seen terms such as neuroforaminal narrowing, neuroforaminal encroachment, or nerve root compression. These descriptions are often referring to the same general process. If a disc herniation on the left side compresses a nerve root exiting the spine, that irritated nerve becomes part of the sciatic nerve system. The sciatic nerve travels down through the buttock, down through the back of the thigh, into the calf, and continues through branches that reach the ankle and the foot. That is why pain can start in the lower back or hip area and travel all the way down one side of the leg into the ankle. Does that sound like the pattern you're experiencing right now? Now, the location of the pain often gives us clues about which nerve root may be involved. For example, pain running down the outer side of the leg and into the outer ankle is commonly associated with the irritation of the L5 nerve root. This is most commonly seen with an L4-L5 disc herniation. If the S1 nerve root is involved, the pain may travel through the back of the thigh, into the calf, and even down toward the heel or bottom of the foot. This pattern is most commonly associated with an L5-S1 disc herniation. When the L4 nerve root is irritated, the symptoms may travel more towards the front or inner side of the thigh, down the inner leg, and into the inner ankle. This can occur with an L3-L4 disc herniation, and in some cases an L4-L5 disc herniation as well. And that brings us to the most important part of this video, the 5 exercises that may help relieve shooting leg pain that travels to the ankle. Before we get into these exercises, there's one important concept you need to understand. To keep things simple, I'm going to demonstrate all 5 exercises using the example of a left-sided leg pain. In other words, we are assuming the pain shoots down the left leg and travels all the way to your left ankle. If your pain is on the right side instead, simply reverse the side shift portion of the movement. Everything I'm showing is designed for left-sided leg pain. If your symptoms are on the right, perform the lateral shift in the opposite direction. These are not random exercises. They are unidirectional movements rooted in the McKenzie method. Each exercise combines a lateral shift away from the painful side with lumbar extension. The goal is to move loading forces away from the side of the disc herniation and away from the compressed nerve root. Research on directional preference has shown that moving the spine in a specific direction can reduce pain and improve function in many patients with disc-related sciatica. As you go through these exercises, pay close attention to your symptoms. Some people respond much better to certain movements than others. One or two of these exercises may provide the best relief, but you will not know which ones those are unless you try all 5. Always stay within your comfort level. Do not force any movement. If an exercise increases your leg pain, increases your back pain, or feels wrong, stop and move on to the next one. The goal is to find the exercise that best relieves your leg pain. Once you have tried all 5, let me know in the comments which one worked best for you. We're going to start with the prone press up with lateral hip shift because this movement combines the 2 key components used throughout this program: a lateral shift away from the painful side and a gentle extension movement of the lower back. This exercise is designed to help reduce pressure on the irritated nerve root by encouraging the disc material to move away from the side of compression. For many people with one-sided shooting leg pain that travels to the ankle, this is often the first movement that begins calming the symptoms.
Okay, first you're gonna lie face down on the floor. I'm gonna use the bed here with your legs straight behind you. Prop yourself up slightly on your elbows and slide your hip and pelvis about 3 to 4 inches to your right while keeping your chest and shoulders centered. To help maintain this position, you're gonna cross your left ankle over your right ankle. From here, you're gonna place your palms flat on the floor directly underneath your shoulders and slowly press through your hands and straighten your elbows, lifting your chest upward toward the ceiling. Keep your stomach, hips, and lower back as relaxed as possible through this movement. It's not easy. At the very top, take a full breath out and allow your lower back to gently sag toward the floor for about 1 second. Then slowly lower yourself back down to the starting position. You're going to repeat this movement for 10 repetitions. So I'm going to demonstrate it again. So you're going to shift to the right. So to keep yourself there, you only want to go about 3 or 4 inches. And then you're going to cross your leg over so that you can keep it in that position. Then you're going to slowly, from this position, push up, take a big deep breath, hold, arch it forward. You want your lower back to kind of sag back down to the floor. So again, I'm on a table, but I'm assuming you don't have this at home. So we're gonna do this on the floor, but we just want to let that drop and sag and do that. You're gonna take a big deep breath, and then you can lower it back down again. And you're gonna repeat that 10 times.
Exercise number 2 is a standing wall side glide. If the first exercise provided some relief but not completely settle your symptoms, the next step is to increase the lateral correction while staying in a comfortable standing position. This exercise places greater emphasis on the side shift component and is designed to move the lower spine away from the side of the leg pain. For some people with disc-related sciatica, a stronger lateral correction can provide better relief than extension alone. Pay close attention to how your symptoms respond as you perform this movement. You stand sideways next to a wall with your right shoulder facing the wall about 1 foot away. Bring your feet completely together. Bend your right elbow and place your right forearm flat against the wall at shoulder height. This will help stabilize your upper body during the exercise. Place your left hand on your left hip. From this position, use your left hand to steadily push your hips and pelvis toward the wall on your right side. Your upper body should remain relatively fixed against the wall while your pelvis glides to the right. Move as far as comfortably possible, then hold the end position for 3 to 5 seconds. Slowly return to the starting position. You're going to repeat this movement 10 times. So slightly different angle here. So we're going to hold this here, just create some support. And all we're trying to do is push in. Remember, this is for left-sided leg pain. So all we're trying to do is open up this area. And so we're just going to reduce and help the body shift over to that right side. So it's a nice, even, gentle glide. All right, do that 10 times. Exercise number 3 is standing lumbar extension with lateral shift. If you responded well to the first 2 exercises, the next progression is to combine the lateral shift with a deeper extension movement while standing. This exercise places the spine in the same corrective direction, but with greater extension loading. The goal is to further reduce pressure on the irritated nerve root and encourage symptoms to move out of the leg and back toward the spine. For some people, this exercise provides stronger relief than the previous movements because it reinforces both components at the same time. For this one, you're going to stand upright with your feet about shoulder width apart. Place your left hand on your left hip and place your right hand across your lower back or sacrum for support. Using your left hand, gently push your hips and pelvis to the right while keeping your shoulders relatively centered. While maintaining the rightward shift, slowly lean your upper body backward and look upward toward the ceiling. You're only going to go as far as you feel comfortable. At the top of the movement, hold the position for 1 to 2 seconds and then slowly return to the upright standing position. You're going to repeat this movement 10 times. So you're going to be here, do the shift first, and then lean back as far as you can. Hold 1 to 2 seconds and come back. So from a slightly different angle, we're just creating some support here, and you're just going to shift to the right and then lean back. Hold to 1 to 2 seconds, and you're going to repeat that 10 times. Exercise number 4 is called standing asymmetric step-up shift. By this point, you have already combined a lateral shift with extension in both lying and standing positions. This next exercise takes a different approach by using gravity and body weight to create a stronger side shift through the pelvis and lower spine. For some people with one-sided shooting leg pain, this movement allows them to achieve a deeper correction with less effort. The goal remains the same: to move the lower spine away from the painful side and reduce irritation around the affected nerve root. Stand next to a low step, a bottom stair, or a sturdy block. Place your right foot flat on the step and keep your left foot on the floor. Next, step up onto the block with your right leg so that your left foot hangs freely off the edge. Place your right hand on your hip for balance, or you can hold lightly onto a wall. Keep your right knee straight throughout this entire exercise. Slowly allow your left hip to drop down toward the floor. As your left hip drops, your pelvis and lower spine will shift to the right. Move only as far as you feel comfortable. Hold the bottom position for 3 to 5 seconds. Use your hip muscles to bring your pelvis back up to a level position. You're going to repeat this movement 10 times, remembering to keep your right leg straight and remembering that this is for left-sided leg pain. So if you're having right side, we're going to do this on the other side instead. But right now, that's all we're doing. The key is to let it drop as far as you can and keep this leg straight and then bring it back up. You're going to do that 10 times. Exercise number 5 is seated lateral pelvic tilt. If standing movements are uncomfortable, or if you are looking for a simple exercise you can perform throughout the day, this is a great option. This exercise uses a lateral pelvic tilt to create a side shift away from the painful side while also encouraging a gentle extension through the lower back. As you shift your weight onto the right buttock, your pelvis tilts and moves to the right, creating the lateral correction. Then by gently arching your lower back forward, you add the extension component. Together, these movements create the same directional loading strategy used in the previous exercises, but from a comfortable seated position that many people can perform almost anywhere. This is the seated lateral pelvic tilt. You're going to sit upright on a firm chair with both feet flat on the floor. Keep your shoulders level and facing straight ahead throughout this entire exercise. You do not lean your chest or upper body to either side, but you're slowly going to shift your body weight onto your right buttock. As your weight moves to the right, you're going to allow your left hip to rise slowly off the chair. Hold your weight firmly on this right side. Now, while maintaining this position, you're going to gently arch your lower back forward. So here. So you're not going to round. We want to keep it in extension. You're going to hold that for 5 seconds. Slowly return to the center position with equal weight on both sides. You're going to repeat that movement 10 times. So again, we're going to shift our body weight to one side without leaning or tilting. You're going to keep that there. We do not want to bend forward. We want to keep ourselves in extension, but you're going to bring your belly forward. So as we shift to the right, you're going to keep that belly forward in extension. Your left hip's going to slowly rise off the ground. You're going to keep your shoulders straight ahead. You're going to hold that for 5 seconds and then come back down. Do it again and come back down. It's not easy. It's going to be tricky to get that balance where you're not shifting back and forth or rotating or leaning off to one side. This is not the exercise. We need to stay looking straight ahead the whole time. So again, my body weight shifts. This is rising. I'm going to hold it up in the air there for 5 seconds and then come back down. The goal of this video was to help you understand what commonly causes one-sided leg pain that shoots all the way down to the ankle. I also gave you 5 targeted movements designed to help reduce nerve irritation and to relieve disc-related sciatica by moving the spine in a specific direction away from the nerve compression. If you tried all 5 exercises, let me know in the comments which one gave you the most relief. Was it the prone press up with the lateral hip shift or the standing wall side glide? Drop a comment, let me know. If you found relief from these exercises, please like and share this video because it helps more people discover safe, non-invasive ways to manage sciatica pain and one-sided leg pain. And remember to subscribe to my channel if you want practical, evidence-informed videos on chronic lower back pain, sciatica, disc herniation, lumbar spinal stenosis, and the exercises and treatment strategies we use to help patients feel and function better. The next video you should watch is this one right here, where I show you the 5-step process we use in our clinic to treat sciatica leg pain and help patients achieve fast, lasting relief. Go watch this video next.